And today is January 13. Once again, this is Sandra Arevalo, Director of Community Health and Wellness, and I welcome all of our attendees today. We're going to be talking about Guide to Cervical Cancer. Our expert today is Dr. Ephraim Resnick, who is one of the doctors that work here at Montefiore Nyack. And at this point, I'm going to defer to Dr. Resnick to tell us a little bit about his background and how he became to be an expert on cervical cancer.
Hi, Sandy. How are you? Thank you so much for inviting me to talk today. Hello, everyone. I want to make it as informal as possible. So anytime you feel like you want to ask a question, go ahead and submit it to Sandy, and she already knows to interrupt me in the middle of the sentence if there's a burning question to be answered, okay? So I'm a board-certified GYN oncologist, which means that after 4 years of general training in obstetrics and gynecology, I went to do fellowship specializing in cancers of the female reproductive tract. I've been practicing this specialty for the last 30 years, and I treat patients not just with a cervical cancer, but with other cancers that are affecting the reproductive tract. With that sort of introduction, I just want to make a quick statement so people are aware that cervical cancer is somewhat unique among all different cancers, not just female cancers, but cancers in general. And it's essentially an infectious disease that's transmitted sexually. And cervical cancer in over 90% of patients is associated with the human papillomavirus, so-called HPV infection. And that infection is very common. HPV viruses are highly mutagenic viruses. We now know of over 100 different subtypes, and a handful of those subtypes are associated with causing cervical cancer. So now that we know that, you can obviously imagine that the major focus of the medical community is on prevention of that cancer, because it has an identifiable cause, being the virus. And now for the last 15 years, we've been campaigning to vaccinate our young girls before they become sexually active against the HPV virus as a primary prevention. The secondary prevention effort is screening with pap smears, with biopsies when necessary, and that sustained systematic effort actually resulted in decreased numbers of cervical cancer deaths, not just in the United States, but all over the world. I have to admit that United States and Europe have lower incidence of cervical cancer as compared to, let's say, East African countries who have the highest rate of cervical cancer in the world. Could it be explained by genetics? Possibly. More likely, it is the healthcare systems in place in those countries that are not necessarily able to provide that initial immunization, as I mentioned, and then secondary preventative screening efforts. With that, I would like to pause and see if people have any questions for me.
Not yet, but I'm the kid in the class that always has a question, so I do.
That's Sandy, you're my favorite already.
So this is, you mentioned that girls should be vaccinated against HPV before they start sexual activity. However, some might start at 12, some might start at 20. So is there like an age?
The recommendation is to start talking to the parents of girls at age 9. Well, you can start talking to the parents even at a younger age, just to prepare them. I have to, by the way, before I fully answer your question, I have to mention that the uptake of vaccination in the population is very low in the United States, surprisingly enough. Comparatively speaking, the Western European countries have the highest uptake of vaccination in their population. The United States, less than 50% of children get vaccinated against HPV. It basically falls on the shoulders of primary care providers, the pediatricians, family doctors, who provide care to the entire family, to the moms, to fathers, to the children, to encourage the young girls starting at age 9 and throughout the teenagehood, maybe up to 14 or something like that, to start getting it's a 3-shot vaccine, and it covers not all of the HPV viruses, but the 2 or 4 most common viruses that are associated with problems. So that initial conversation has to take place between the parent and the pediatrician, most likely.
It's also like a limit age until you could vaccinate a girl?
It's actually a very good question. What happens when a person is, let's say, in her late 20s and she gets screened for Pap smear or HPV infection, and she finds that there's already some sort of changes in her cervix that were caused by the HPV viruses? The recent data is actually showing that those people also benefit from the vaccines. So there's a second tier of vaccinations now that being studied and published in the older people. Older, I mean people in their 20s and 30s who were not vaccinated as children. Do they benefit from vaccinations, even though they're already showing some signs of infection with HPV that makes them at a higher risk for cervical cancer? And the answer is the data seems to indicate that those people will benefit from that as well. And once again, it's a primary care providers like their general OBGYNs who would be addressing this issue. I have to remind people that as a specialist GYN oncologist, I mostly deal with people who are already past all of these stages of prevention, either primary prevention in young girls or secondary prevention with vaccinations and Pap smears and HPV testing. By the time patients are referred to me by their primary care providers, it usually means that the woman has some sort of either severely precancerous or outright cancerous findings on her cervix. My wish for all of the listeners for them to never come to meet me professionally because they don't need my services.
Yeah, that wouldn't be great for you, but it will be great for humanity, I guess.
It will definitely be great humanity, great for me as well.
Yeah, and people still will have babies, so I think you will never be out of
I don't deliver babies. That's what the specialty of GYN oncology does. I primarily do surgeries, even if they're not cancer surgeries. I do surgeries for women with complicated pelvic issues that maybe their general OBGYN does not feel comfortable taking care of. Those people are referred to me as well for more sophisticated type of surgical procedures and of course cancers. But unfortunately, I no longer deliver babies. Haven't delivered a baby in 30 years.
Oh, wow, look at that. So Anne-Marie is asking, when did the vaccine come out? She says, if I'm in my 50s, should I get a vaccine? Not sure I ever received one.
Marie, it's a very good question. Thank you very much for asking that. So vaccine has been around already for about 15 years, and there's plenty of data to show how well it works in populations that are at a high risk. The fact of the matter is, because it is a sexually transmitted virus, social behavior. So if a patient also makes her either at a higher risk or intermediate risk or low risk. For instance, a person who is celibate, who does not have any sexual intercourse, she probably doesn't need any vaccinations at all because she's not exposed to HPV viruses. A person who is in a monogamous long-term relationship and has had multiple yearly normal pap smears and does not have new sexual partners probably does not need a vaccination either. However, regardless of the age, even if the person is in their 70s, I know you mentioned that you're in your 50s, but even a patient who is in her 70s, if she gets a new sexual partner, it is almost axiomatic that she will get new HPV subtypes that her immune system has not been exposed before. And depending on the level of her immune system, she might either be able to eliminate that initial infection, or the viruses might colonize her genital tract. And in this case, the duration of exposure of this persistent colonization of the genital tract with HPV viruses is what's making her at risk for cervical cancer. Whether a older woman, and I'm gonna let the listeners define what constitutes an older woman. I'm not assigning any age, but a woman who is later on in her life and she feels that her social life is such that she is exposed to multiple new HPV viruses, which come with every single new sexual partner. Indeed, maybe such a person should consider getting vaccinated. On the other hand, if a person is not exposed to multiple HPV subtypes that are new to her system because she's in a monogamous, long-standing relationship, perhaps such a person does not need this vaccine.
Mm-hmm. How do you get the vaccine? Now you may be interested.
Just like any other vaccines, most primary care providers have that in their offices. So for young children, it would be pediatrician, and for older women, it would be their regular primary care OBGYN.
Yeah. So we have another question. Is the vaccine for boys as well?
Your audience, Sandy, is outstanding. They are right on target. Whoever asked this question is right on target. It has been discussed already for the last 15 years. Why are we vaccinating only the girls? Well, the initial thing was because it's only the girls who are getting cervical cancers. But the boys are the transmitters. They're the carriers. They're the one who pick up HPV infection from one partner and might pass it on to the other partner. Why not vaccinate the boys as well? And indeed, over the world, there are some countries that do vaccinate boys. In this country, it has been a debate. And there's no contraindication to vaccinating the boys. I'm not familiar with the most current statement of the American Academy of Pediatrics as to what their recommendation is about vaccinating boys. But a parent should certainly ask the pediatrician and have this open conversation with the pediatrics community that take care of their children. Excellent question. I don't have a simple answer.
Okay, and is the vaccine covered by insurance?
It's a good question. I think so, but I don't know.
Okay, so I guess we'll wait to see what happens. When we get the bill, we'll know. Now we have another question. My sibling is 22 and no one in our family knows if they received either dose of the HPV vaccine. They aren't and have never been sexually active. They have yet to start hormone therapy, but it's not as though their cervix will disappear. Should they get the vaccine?
I'm not 100% sure I fully understand the question as far as the interaction between the hormone therapy and the vaccines. Those two are two separate topics and are not necessarily related. I'm going to try to answer. If it answers the question, great. If not, maybe I can ask the person to rephrase their question again. So at age 22, somebody who has never been sexually active, I would strongly recommend that they should get that vaccination. Because there's really very little downside to receiving the HPV vaccine, but it will protect this woman when she will become sexually active. Again, I did not quite understand what the hormonal therapy has anything to do with this.
Yeah, and now Edith is sharing a comment with us. She's saying the HPV is covered by Emblem Health coverage because her daughter received that vaccine and she never got a bill for it. But everybody should look with their own insurance. So thank you, Edith.
I have a feeling that most, if not all, insurance companies are covering, because it's an FDA-approved vaccine. It has been around for 15 years. It's recommended by majority, if not all, of the medical societies in this country. So I would be shocked to hear that there is a plan does not cover preventative care, which is what this vaccine is considered.
It's about, yes. And Caitlin has elaborated on her question, and now it makes total sense to me, at least. She says she means that her siblings were born designated as female and intend to begin hormone therapy. I believe they must be transgender. So yeah.
So again, the vaccine works to prevent colonization of the female lower genital tract with HPV viruses. Without giving any specific recommendations to a specific healthcare situation, you need to ask those questions to your own physicians. If there is a possibility of the vaginal vault being exposed to HPV infection, then vaccine should be given to prevent that initial colonization with a high-risk viral subtypes of the vaginal vault, vaginal canal. Again, I don't know any specific details of the patient in question, nor would I be making any specific advice or recommendation. But certainly, if it is a risk for sexual intercourse, then it would be highly advisable to bring that discussion up with the healthcare providers.
Mm-hmm. And we have another interesting question, Dr. Resnick. Keely is asking if HPV is an STD, why can it show up on a person's cervix who is a virgin?
Well, STD is a sexually transmitted disease. So in order for the HPV as a virus to show up on the person's cervix, there had to be some sort of sexual exposure. Now, there are a few extremely rare cases, and I've heard of them, of pediatric newborn patients being colonized with HPV, perhaps from the birth process. Most other cases should raise question of some sort of a sexual abuse in the pediatric population, because again, it's a sexually transmitted disease, and for a person to have HPV in her genital tract, there had to be some sort of a sexual exposure.
Mm-hmm. Now, let me ask you something back to that. So would that mean that a virgin will never have cervical cancer?
In fact, that is a very correct statement. There are hardly any cervical cancer, let's say, in some religious orders where women go and become completely celibate and they have never initiated sexual intercourse at all. Cervical cancers are extremely rare. If you recall, at the very beginning of our conversation, I said that over 90% of all cervical cancers are indeed HPV related. Now, that means that less than 10% of cancers might not be HPV related, but those are extremely rare. I would definitely not advise any woman of any age to skip going to a gynecologist for annual checkup and visit, because multiple other issues can be picked up on the examination, especially in the elderly women who tend to say, why do I have to subject myself to this very uncomfortable examination? I'm already very, very elderly, again, whatever that age means. And women conscientiously decide not to go for gynecological checkups. And then, quite frankly, some of my patients who are octogenarians and nonagenarians, who are brought to me by their caretakers, I don't want to use the word have been neglected, but they have issues that could have easily been picked up on a routine annual examination by their regular gynecologist and would not have ever needed to come to see GYN oncologists at their advanced age. And again, it doesn't have to be just cervical cancer. There are many other cancers that can affect the reproductive genital tract and can be easily detected on the screening examination once a year.
I guess besides the vaccine, because if the vaccine only came out 15 years ago, then of course, a lot of us missed that. So what are the other ways to prevent cervical cancer that is not the vaccine?
So we already alluded to a couple of things. Number one is social or lifestyle type of issues that people have control over. For instance, multiple sexual partners increase the woman's risk for different subtypes of HPV exposure that her immune system might not be able to handle. So limiting number of sexual partners, becoming in a steady relationship, is definitely decreases a woman's risk for cervical cancer. Number two, I mentioned immune system multiple times. So anything that compromises her immune system, such as, for instance, cigarette smoking, that has been clearly shown to compromise the immune system, especially the cellular immune system, which is primarily responsible for fighting against the invading viral infections. So women who smoke are at a much higher risk for cervical cancer because their immune system is not working. People who are under tremendous, let's say, some psychosocial stress from divorce, from stressful work environment, from stressful family situations, living in the war zone. There are multiple psychosocial stressors that affect immune system. Guess what? Once the immune system is compromised, these people are at a higher risk for cervical cancers. Now, some things can be controlled, such as diet, smoking. Some things cannot be controlled, such as stressful environment. But if people can sort of be cognizant of their mental well-being and their mental health and decrease stress, it will all help their immune system. And thirdly, we've had now for over a century screening techniques to detect cervical cancer or even precancerous lesions way before they become a life-threatening situation. Papa Nicolau smears, colposcopy and biopsies, all of those are part of the armamentarium of the general OBGYNs and family practitioners in the community who our tasks are to provide this primary care and preventative measures to people in the community. I will strongly encourage women, whether they had vaccines, whether they didn't have the vaccines against the HPV, to go for annual HPV testing and Papa Nicolau smear screening, and older people, if they have a new sexual partner, guess what? You just got exposed to new HPV types. You should probably go and get an HPV test, even if your provider said, well, for the last 25, 30 years, all your pap smears were normal, and recommendation is no longer test you for HPV and pap smears. Social situation just changed. The person got a new sexual partner. She should really start getting tested. I frequently tell my patients, virus is dumb. The virus doesn't know whether you're 18 or whether you're 88. The virus will infect a person's tissues, no matter what the age is.
And Kathleen is asking, in a general yearly GYN exam, do they test for HPV when they do the PAP, or is that something that you have to ask for?
They definitely should. And if you're doubting whether your physician does it, you definitely should bring it up, and you should definitely ask. Annual HPV testing is definitely recommended.
Okay, now let's talk about symptoms a little bit. So if you have or are developing cervical cancer, how can you identify it?
Good question. Now we're switching and we're moving our conversation into the area that I spend most of my working hours dealing with. And that's people who have already been diagnosed with cervical cancer. So how does the cervical cancer get diagnosed? The best way for it to get diagnosed is before any symptoms set in. The best way to diagnose cervical cancer is on a routine annual screening where something abnormal comes up, and then the next step of evaluation takes place, and the physician takes a little biopsy, and then we find microscopic tissue that invaded. That's the best type of prognosis, because the cancer was detected very early in the course of the disease. It is very unlikely to have spread anywhere. It's located just in the cervix, and we can easily treat it. And the cervix lends itself to this early screening and early diagnosis, so we can intervene early on in the course of the disease, which is a cervical cancer. If the disease is detected later, by the time the symptoms set in, it might be already more advanced stage cancer. In that case, therapy and cure is still available, but it's much more difficult to achieve that. So let's talk about early symptoms of cervical cancer that people might experience. Now, the cervical cancer can grow in one of two ways. It can grow outwardly in the cervix, almost like forming like a little cauliflower growth on the top of the cervix. And that growth would bleed very easily. So a person might have some spotting, painless spotting after sexual intercourse, because that little knob of cancer that's growing in her cervix was disturbed during the sexual intercourse. So this early post-coital, post-sexual intercourse bleeding episodes is definitely a red flag that needs to be brought up to the attention of the physician, and they have to be evaluated. Now, sometimes the cervical cancer grows inwardly, and instead of forming a cauliflower protrusion the way I just described a couple of minutes ago, it grows inwardly. And there, symptoms occur much later and very different symptoms, because inward growth of the cervical cancer will now start interfering with the bladder function. The person might have some urinary symptoms. The person might have some bowel movement symptoms, because the cancer might be involving posterior aspects of the pelvis where the rectum is, or if there's a side spread of the cervical inside the body, it might start impinging on some vessels, blood vessels, and nerves. So a person might have a swelling in one leg more than another leg. The person might have pain on one side more than the other side. That would all be a symptom that there's something growing on inside the pelvis that is not normal and needs to be evaluated.
Treatment? Should we move to treatment?
Treatment depends on the stage at which the cancer has been found. If the cancer is in situ, meaning that it has not invaded yet, then a simple excision of that area would suffice. A person doesn't even need to have a big surgery. Now, if there's already been an invasion into the deeper tissues, then excision of the cervix alone is not sufficient, and a person might need to start undergoing hysterectomy. And depending on the depth of invasion, this hysterectomy might be either simple or radical. Radical hysterectomy removes quite a lot of tissues that surround the uterus and surrounds the cervix and surrounds the vagina. It's a much more aggressive form of therapy in order to eliminate all potential for cancer cells remaining inside. Now, once the cancer starts progressing further and further, surgery might no longer be an option because we cannot achieve clean margins around the tumor. Even if we wanted to do the surgery, there's not enough margins because, as I mentioned, there's a bladder in the front, there's the rectum in the back, there are blood vessels and nerves by the sides. So if the tumor is large enough, you cannot surgically excise it, you will compromise other structures. In that case, combination of radiation and chemotherapy is very effective. Cervical cancer tends to be very sensitive to radiation therapy. We used to treat cervical cancer primarily by radiation therapy when it was an advanced stage. And then about 25 years ago, we discovered that if you add a little bit of chemotherapy during the radiation therapy sessions, it makes the cancer cells so much more sensitive to radiation. So this chemotherapy sensitizes the cancer cells, and radiation therapy works even better. So we can achieve complete cures even in stage 3 and 4 disease. Obviously, it's not as common as it is if it would be early stage disease, but it's not a doomsday scenario if a person is discovered in a more advanced stage of cervical cancer. There's plenty of options for therapy, and the cure can be achieved as well.
And Anne-Marie is asking, at what stage are most cervical cancers diagnosed?
That's a good question, Marie. Very good question. So it all depends on the part of the world you live. It all depends in the socioeconomical population that you live in. And all of that basically boils down to what kind of healthcare system the woman is exposed to, what's available to her. Those people who are more educated, people who live in more affluent areas, who do partake the screening options that are available to them, are diagnosed in very early stage disease. People who neglect their own health, who don't go for routine screening, or people who live in areas where healthcare is not available for routine screening, where it requires hours and hundreds of miles of travel in order to receive the primary care therapy. Those people, unfortunately, are diagnosed at the later stage. So to answer your question, it depends on where you live and what your level of education is and how proactive you are in taking care of your own health.
Mhm. Now, Caitlin is asking, my aunt on my mom's side died from brain cancer. That being so, am I at higher risk for cervical cancer?
It's a good question. So some cancers we know are genetically related to your family members because those mutations in the genes are passed from generation to generation. For instance, breast cancer is a perfect example of something that might be genetically related and inheritable from your predecessors. Colon cancer is the same way as well. Cervical cancer is a sexually transmitted disease. It has nothing to do with the genetics. It's not something that a person inherits from their mother and father that the mutation makes her more predisposed to cervical cancer. It's more of an HPV infection that gets transmitted during sexual intercourse. So I'm not answering your question directly whether the brain cancer in the family makes somebody at a higher risk for cervical cancer or not. Anything is possible, I suppose, but from everything that we've talked about today, cervical cancer is not one of those cancers that is associated with an inheritable genetical mutation.
Mhm. And I'm wondering, after you have cervical cancer and you've had surgery, can you still have sexual intercourse?
Well, the sexual intercourse after surgery is an issue that is being discussed everywhere, and that topic has been pretty much put to rest many years ago, where a study on several thousands of women across the country and so-called the prospective nurses study that have been reporting multiple health issues also addressed an issue of sexual health after hysterectomy. And that study pretty much definitively showed that sexual health after the hysterectomy is predicated on the sexual health before the hysterectomy. So for 95% of women, there was absolutely no change after the hysterectomy as far as their sexual health is concerned. There were some outliers for whom sexual intercourse was more positive experience after the hysterectomy. And on the other hand, there were people who reported that their sexual experience after hysterectomy decreased. Now, that addresses only the surgical aspect of treatment of the cervical cancer. Those people who are treated with radiation therapy and chemotherapy are a totally different group of patients because radiation therapy affects all of the tissues in the pelvis. It affects the bladder, it affects the vagina, it affects the rectum. And the radiation therapy tends to stiffen tissues. They're not as pliable and stretchable as they are before the radiation therapy. So women, regardless of their age, who have had pelvic radiation are uniformly reporting that their sexual health is different after radiation therapy. And without going into any specifics, those people who did have radiation therapy to the pelvis, whether it was for cervical cancer or for rectal cancer or for any other multiple indications as to why a person might have pelvic radiation, they need to be very much cognizant of their sexual health and bring it up for discussion with their physicians very early on in the course of their radiation therapy and subsequently to it. And then many long-term effects can be either prevented or avoided.
Yeah, thank you. And Margaret is asking, are the primary doctors supposed to educate patients about HPV?
Yes.
Yeah, we should all know about these things.
100%.
Yeah, and talking again about HPV, this is what I'm wondering. So men can give HPV to women, and then if you have a different partner, can women also change the HPV colonies in men?
Yes, absolutely. It is like any other sexually transmitted disease. So for instance, a woman in a relationship might be monogamous, but if her partner is not, he will be bringing new HPV subtypes into this relationship. Vice versa, if the gentleman is monogamous and his partner has other sexual partners, he will be picking up these new viral subtypes from her. And if he has a new sexual partner, he will pass all those new subtypes to her. Now, uncircumcised men do have a risk of HPV infection that might result in some penile cancers. The circumcised men usually don't have that issue, and they're just simply carriers. Those HPV changes that occur in the women's genital tract are occasionally can be seen in the male partners, but those are very much easily discoverable because it's much more easy for the gentleman to see what's happening with his genitalia on a daily basis than for a woman to know what's happening inside her body. And that's why it is so imperative that women continue to go for annual GYN examinations.
And Nereida is asking, can a woman hygienics routines increase the risk for cervical cancer, like douching or using chemicals for cleansing? Is that something that can increase risks?
It's a good question. And the answer is that before HPV was definitively proven to be the leading cause of cervical cancer, and that occurred already probably 30 years ago, there were multiple other candidates for being the causative agent of cervical cancer. Chemicals with douching and what have you. The herpes infection, other sexually transmitted diseases, all of those things were being studied and trying to discover, are they contributing to the cervical cancer? And we definitively closed that chapter 30 years ago. HPV is the big gorilla responsible for overwhelming majority of cervical cancer. The herpes infection, the douching, any kind of creams that person puts in her vagina, or any other hygiene type of practices that you might use, is probably not associated with the cervical cancer whatsoever.
And are there any side effects to the vaccine?
Like any other vaccines, it has very rare side effects. Now, most of these rare side effects is not associated with an actual viral DNA or RNA or any other things. Most of the side effects are associated actually with what we call the vehicle in which this vaccine is being delivered. So for instance, if a person is allergic to eggs, or if she is allergic to some proteins and other things, she might have an allergic reaction to the vaccine, not because of the virus, but because of the vehicle in which this vaccine is being delivered. HPV vaccine does not have any higher or different profile of risks than any other multiple vaccines that medical community strongly recommends that people take. Childhood vaccines and adult vaccines, and obviously we live now in the COVID-19 era where vaccines are forefront everywhere. And I'm not going to get involved in discussion of the vaccines, but it's clearly that the 15-year period of us having data, worldwide data on HPV vaccines have proven its efficacy and have proven its safety.
Now, is the HPV something that you measure or you can identify in the pap, or do you need a separate test?
It's a test, it's a completely different test, but it's done during the pap smear. The same smear, the same collection tool that collects the cells from the cervix also collects the tissue that can be now tested for HPV. It's up to the physician to order this. There is something that's called a reflex HPV, meaning that HPV will be tested only if there are some abnormalities that are detected on the Papa-Nicolau smear. As a specialist in cancer, I personally do not like this at all, because the studies all over the world, including this country, show that HPV testing is a much more sensitive and much more predictive testing than the cytological Papa-Nicolau smear testing. In fact, in some countries, the cytological testing is no longer recommended at all. It's primarily HPV testing that's recommended. In this country, there's quite a lot of co-testing going on, which is fine. I do not object to having cytological testing, but HPV, especially the high-risk HPV subtypes, in my opinion, should be routinely screened during the Papa-Nicolau testing.
And Anne-Marie is asking, does the vaccine permanently eradicate HPV in a woman's body, even with multiple future partners?
Outstanding question. No, vaccine does not permanently eradicate the virus, nor does it permanently and 100% prevent the possibility of women getting an infection and developing cancer. What the vaccine does, it dramatically decreases the chances of this event happening. So we know now from the last 15 years of having these worldwide data is that vaccinated women have a much lower rate of high-grade dysplasias, precancerous changes in their cervix. More importantly, they have a lower rate of developing cervical cancer and ultimately more risk of dying from the cervical cancer, because everything that we do basically is focused on death prevention.
And Nereida asks, is there a difference in risk related to the age of the initial HPV infection?
Indeed, young girls or young women who become sexually active at a younger age statistically are known to be in a higher risk category. So the person who has initiated her first sexual intercourse at a younger age is at a more risk than a person who initiated her sexual intercourse at an older age. Women who have lifetime 5 sexual partners are at a different risk than women who had 50 lifetime partners, so 500 lifetime partners. People fall into different risk categories. That's why the recommendation is to start vaccinating children anywhere between ages 9 and 14 before they become sexually active, in order to make the risk of the age of first sexual intercourse be less of a differentiating factor.
And is the HPV vaccine, or does the HPV vaccine have anything to do with your ability to have babies or get pregnant?
it has not been shown at all. Over 15 years of usage worldwide, there has never been reported any increased incidence of inability to conceive and to carry pregnancy to term. Treatments to the cervix that are administered after the HPV infected the cervix and caused some precancerous changes. And now the physicians have to treat the cervix before this precancerous condition turns into real invasive cancer. Those treatments can actually lead to compromise in a woman's ability to conceive and carry the pregnancy. The vaccine itself does not.
Mm-hmm. And Kelly is asking, how long can HPV remain latent in a woman's body?
Long time. If you remember, HPV as an infection, as a virus, is not living independently. It's living within cells, and it's being counteracted by a woman's immune system. So 3 case scenarios. A woman gets a new sexual partner and she gets infected with a new strain of HPV. And her immune system immediately jumps in and completely eliminates the transient viral infection. In fact, that's what happens in the majority of young women who become sexually active. They transiently become infected with HPV, and then their immune system very quickly eliminates it. That's one case scenario. Another case scenario is on the other spectrum, where a woman's immune system is so terribly compromised that even that first initial exposure to the new HPV virus results in immediate changes in her tissues and her cells. So her immune system is completely incapable of controlling this infection. And the third case scenario is what your question is asking, the latency. The infection might have happened and the immune system was able to control it and suppress it, but it was not strong enough to completely eliminate it. And then that HPV sits and basically grows together with the tissues. As the cells divide, each new cell gets a little bit of that HPV DNA, and it keeps going and going and going. And it could be after 10, 15, 20 years, where all of a sudden the immune system no longer can control the persistent infection, and the infection now takes over. So latency with HPV can be very, very long.
Wow. And we're coming towards the end of our community chat from today. Doesn't time fly when you're having fun? Because
I've enjoyed it.
Can you believe it's 60 minutes, almost 60 minutes already? We were saying, well, 45 to 60. Look at this. Very good questions from our attendees. Thank you so very much for your participation. Thank you, Dr. Resnick. I mean, the way that you explain everything is beautiful. Usually, you know, I try to translate things from the medical jargon to the public, but you did great. Like, I want to have you again in our show because look how many people we have today. Everybody's very interested on this topic, and I'm sure that is not the only topic that you're an expert on. So hopefully we can have you again. And
it'll be my pleasure, Sandy. Thank you.
Yeah, that'll be great, really. And next week, we're going to be talking about mental health resources available in Rockland County, and we'll see, maybe beyond Rockland County as well. We know that a lot of people over there with COVID and a lot of things that are happening in the world, we need mental health services. So we're going to be talking about where to get them, where they are available, who is there to help, and all of that. Thank you again, Dr. Resnick. Thank you to all of our attendees. Great topic. Don't forget to watch the recording, and I'm going to be sending the recording to you as well. Don't forget to watch the recording, and please tell your friends, tell your family members, vaccinate yourselves, your daughters. You know, I also never know. I don't know if I have the vaccine or not, but I'm getting one no matter what. And I invite everybody to do the same. Let's prevent cervical cancer. Until next week.
Everyone should have a great day.
Thank you. Thank you.
Bye, Sandy.
Bye-bye.